We might quickly just go straight into Associate Professor Gillian Gould's presentation around SISTAQUIT. Thank you, Ben. Be just a sec, Gillian, and it'll be up running. Would you unmute yourself, Gillian, when you're ready?
I'm getting feedback.
Are you?
How about that? Can you hear me now?
Yes, much better.
Just showing my screen. Sorry, everyone. Just have to go back. Oops. Go back to the slides. Beginning. Oh, okay. Ready to go. That's great. Sorry about that, everyone. So first of all, I'd just like to acknowledge the traditional owners of the land from where I'm talking today, which is in Coffs Harbour, the Gambanja people, and just pay my respects to elders, past and present, and also, you know, acknowledge the Aboriginal and Torres Strait Islander people on the meeting today, and also just mention that my team are actually spread over a couple of sites. So this is just some of the SISTAQUIT and SISTAQUIT team. So some of these people you might have come across. So we're a mixture of some non-Indigenous people and Aboriginal people who are working collectively together on some work on SISTAQUIT, some work on SISTAQUIT, and there's a couple of people do work on both. And, you know, we have members here and in Newcastle at the university, but also working remotely. So Dr. Tane is working from WA and Leah Stevenson's working from Cairns, Atherton. So that's us as a group. So just first of all to go over the importance of why it's important to help women quit smoking in pregnancy. So we do know that smoking is the main risk factor for low birth weight. And there have been studies that have looked at the birth weight of Aboriginal and Torres Strait Islander women and women in the general population in Australia. And really birth weight is the difference. Although not to say there aren't other challenges, but and one of the new closing the gap targets now is improving birth weight in babies. So it's going to be difficult to improve birth weight in babies if women are not given that support to quit smoking. We know that the national prevalence is that 44% of pregnant Aboriginal and Torres Strait Islander women smoke during pregnancy, and those rates are higher. So in very remote areas, so the percentage for remote areas 48%, and in very remote 55%. And we know in parts of the Northern Territory that those rates are on the high side. When we've done quite a lot of research around what women are thinking and feeling about smoking in pregnancy, you know, pregnant women are saying they are motivated. They are motivated to quit, but they're also telling us they're not getting enough help to quit smoking. And we also know from our surveys and interviews with health providers that health providers are not confident when it comes to providing assistance to pregnant women in particular, because there are some differences. You know, they're very uncertain about how to prescribe nicotine replacement therapy, whether whether that would be needed or not. They also they're reticent about, impacting the relationship with pregnant women. They don't want to put people off coming for antenatal care. However, we also know that training health providers can double quit rates in general in smokers. So, helping women quit, has the advantage of helping babies avoid lifelong health problems and also behavioural and learning problems. So it's all kind of positive news. Like, there's really no reason not to help a pregnant woman quit smoking. Okay, next slide. What are health providers doing right now? So this is based on a survey we ran in GPs and obstetricians nationally in Australia. And we wanted to know how well they thought they were going on performing all the different aspects of the smoking cessation counselling. And we found, look, people are really good at asking and advising now. But, when it comes to some of the other issues, like actually helping people quit or helping them make a quit plan or set a quit date, those things dropped right down. And particularly in terms of assisting women by providing NRT, but even with referrals, the referrals, arranging referral, surprisingly low. Although this was done in GPs and obstetricians, we do have data from actually across the whole world where we've looked at about 13 different countries and other health providers like midwives, nurses, Aboriginal health workers. And honestly, if I put the graph of that one there, you wouldn't see a difference. It's absolutely identical to this. So we know this is common, and this doesn't just apply to Indigenous women, it applies to, pregnant women in general. So we know there are gaps, and those gaps need addressing. So we developed SISTAQUIT. It used to be called, I'm just showing this to show the trajectory of where we've come from, because some people might have heard of our other iteration, which was I Can Quit in Pregnancy, which was when we first started developing our resources, pre-testing them. We pre-tested them in 3 states, not in NT, unfortunately. Then went into a pilot study, which was phase 2 of I Can Quit in Pregnancy, 6 services in 3 states. And then phase 3 at the moment, we have the SISTAQUIT trial running. And I'm going to tell you a little bit about what is the difference between SISTAQUIT and iSISTAQUIT. So we have phase 3 running, we have phase 4 running, which is iSISTAQUIT. And we've got aspirations for phase 5, which would be the scale up of SISTAQUIT nationally and looking at how we can adapt a SISTAQUIT internationally. So there's quite very strong interest from Canada for them to have SISTAQUIT over there for First Nation Canadian women. So just before I go on to the differences between the different projects of phase 3 and phase 4, I just want to mention for those of you who might be new to what we're trying to do is we're using an ABCD approach. So the ABC approach came out of New Zealand as a way to simplify and help people remember more easily what they're supposed to be doing when they see a pregnant woman or a woman in general. So A is for asking and assessing how much they smoke. B, giving clear, brief advice to quit. The cessation is to offer behavior change techniques, so that, broadly you could think of that as counselling, and nicotine replacement therapy. In this case, because that's the one that's actually approved for pregnancy. And then we added the D, which was a reminder really to discuss the family, social, cultural context of smoking in pregnancy, because this is and when we had the smoking in pregnancy roundtable, there was definitely a very strong acknowledgement that our approaches should be trauma informed. And, you know, we do need to think about the social determinants of health, which do impact people's behaviour. And, you know, so that's a reminder there, in whatever way you think appropriate, to go into those issues and advocate for the woman, you know, if she's having some issues around those areas, financially, housing, etc., you know, to link her to services, etc., and then try and involve the family. So just coming on to a little bit of a difference between SISTAQUIT and iSISTAQUIT, because we know we do have sites in the Northern Territory involved in the SISTAQUIT trial, and we are still recruiting for iSISTAQUIT. So SISTAQUIT is funded by the National Health and Medical Research Council and the Global Alliance for Chronic Disease, and it's a randomised trial in 20 services. So what a randomised trial means is that half the services will get the SISTAQUIT intervention, and the other half will just do their usual care, whatever they normally do, as control sites. And by choosing those sites randomly to go into either, you know, one or the other, we can get the best idea of how SISTAQUIT is actually really helping compared to what usual care normally is. And the intervention is actually training people in health providers in culturally competent, evidence-based care for smoking cessation that we developed when I showed you that timeline. And the health providers and service collect data. So they collect data from the women, from the health providers. We collect data from like before and after the training and see how they're progressing. We collect service level data, and we also ask the health services to collect data, recruit pregnant women and babies, and collect data and follow up to 6 months postpartum. So we're looking obviously at things like quit rates in pregnant women, but a whole lot of other outcomes. And in the babies, we're looking at, do babies have a better outcome with their respiratory symptoms and birth weights, etc. So when it came to the Department of Health and TIS offering us the funding for SISTAQUIT, we called it iSISTAQUIT, meaning implementing SISTAQUIT. Now, this is going to be an implementation of training in about at least 20 more services. And what's different from the trial is in iSISTAQUIT, all sites are going to get the training and the resources we've developed. And instead of having to recruit women into the trial, like actually, you know, recruit them individually, we're developing some software templates for things like medical director and communicare, so that when the health provider is doing their normal consultation, they can be putting in some data, and all of that's going to be analysed in a de-identified, grouped way. So we're identifying women in particular. And then we've also been asked to develop a social media campaign to go with it. So I'm just going to give you a brief update on where we're up to with both studies. So with SISTAQUIT, we have recruited 23 services, 20 ACCHOs and 3 mainstream. And 7 of those sites are regional TIS teams. So in Northern Territory, we've got Catherine West and we've got Danila Dilbra. So far we've recruited overall 90 health providers to the trial and 60 women, and there's been 9 babies born so far that have been recruited. And we've got an extension of the trial to early 2022. So I'd just like to echo what Tom said about data and evaluation. So a little quote there from Sir Arthur Conan Doyle, who wrote Sherlock Holmes: data, data, data. I can't make bricks without clay. So we recognise there's been some challenges with COVID-19. For a while we had to stop recruiting, but we're back recruiting now for SISTAQUIT. We do need our participants to be followed up regularly. We need that data coming in, because without data there is no research, basically. And we now have added some incentives that's been approved by ethics. So the health providers who have been a little bit sluggish about providing their follow-up surveys will now have a $50 incentive for each survey. And we've got incentives, for the research facilitators are helping collect data, for the women, and we're going to be doing some mid-study interviews, and everybody's going to get $50, for anything. So we're hoping to actually get a bit more data coming in. So coming on to SISTAQUIT, which is the implementation, as I say, we're still recruiting for this part of the study. So we've had over 40 services express interest, and we've been asked to here recruit equal numbers of Aboriginal services and mainstream services for this study. We have 11 services ready to sign up. We're just preparing the documentation now. And we need 9 more services. So, we think we're going to get those quite easily from all of those services that expressed interest. But I have talked about Desley for reserving 3 more places for TIS teams out of those allocation of 20. So, we are very interested to hear if there are any other services in the Northern Territory that might like to come on board. And as I said, all sites will get training, they'll get resources, they'll get carbon monoxide meter, they'll get oral forms of NRT to give to the women. And we've got our e-learning, our training now as an e-learning modules. It's looking really great, and it's pretty well almost ready to go. And we've got these communicare templates, which is really going to help guide your consultations at the services. These are just a little bit about the resources for SISTAQUIT, just to show you what they look like. So there's a patient booklet that the women get with some cool colouring in templates. They can just have activities there. It's a self-help booklet. There's lots of embedded videos that they can look at with a QR code in that booklet. There's a treatment manual. There's a flip. The health providers get a flip chart if they want to use with consultation. And then this kind of squirrely snaky thing here is actually from our e-learning. So this is how this is going to be self-paced. It's going to take about 4 hours in total to complete that training. But, it can be done in small chunks, either on a computer, an iPad, or even your mobile phone. So just to make it really easy for people to do that training. And we're now working on the media campaign at the moment. So we did a scoping review of quit messages and media, and we've completed that. So what we did is we looked at all of the literature on Aboriginal and Torres Strait Islander women in Australia. What were women saying? What were they saying they needed for this issue? And then we looked at 18 different campaigns that are targeting pregnancy in Australia. For Aboriginal women or Torres Strait Islander women, and then we match the two. It's like, this is what women are saying they want, this is what the campaign's doing, like where perhaps does that meet, and they do meet a lot, but there's some certain interesting areas that are not necessarily being addressed that could be new ideas for health messaging. So we will be publishing that. We'll make that available to people when we can. We have got a social media advisory panel ready to go, and we now have a creative company signed up called Galimba, who are going to film and do our media campaign in 4 to 5 locations nationally. Now, we do recognise there's some, obviously, going to be some challenges with COVID-19 and not being able to get into communities, but we've had 3 communities expressed interest. So far we've had Torres Strait Islands, Wagga Wagga, and one other site in South Australia, but we're looking for 2 more sites. So the advantage, if any of you are interested to sign up to SISTAQUIT and become a site that wants to help us to develop the social media messages, you'll get some really cool short videos that you can also use to engage your local community that are very specific, you know, to your community, because they'll have your women's stories in them. So please get in touch. And we're hoping to use various channels like YouTube and Facebook, etc., for disseminating that. And we are planning to still stay on track to launch that at the end of the year. So just a little bit of an opportunity. We are hiring a new project manager for SISTAQUIT. So when you get the slides, anybody can click on that. It is going to be located in Coffs Harbour, I have to say. So, but if you do know anybody or anybody wants to relocate, let us know about that. And just look, I know we've touched on the COVID issue. I just want to say that's really important to keep that on the agenda, because pregnant women are, you know, would be vulnerable like anyone else. But there's also, you know, just I don't think the NT was so badly affected with the bushfire season last year, but there is a kind of risk for pregnant women if they're inhaling bushfire smoke. It's very similar effect on birth weights compared to the effect of tobacco smoking. So, you know, we just want you to keep that in mind, that, you know, use these as opportunities to promote quitting to pregnant women. And, you know, while we do have a lot of people quitting due to COVID, also some people can respond the other way, and with the stress of smoke, stress of disasters and isolation can actually turn some people to smoking more. And I just want to finish with giving a plug to a lot of you might have known Dr. Michelle Boville, who's a postdoctorate Aboriginal research fellow. And she's doing this fantastic study at the moment called Which Way, which is actually finding out from women, well, which pregnant women, which way would you like to quit? You know, what, you know, to sort of generate some new ideas and innovation around helping pregnant women quit. So she has got a Facebook site and an online survey. I'll try and get that link for you to send on. And she's going good in New South Wales and Queensland with surveys, but she would like some more from the Northern Territory if possible. And, you know, it would be great to be able to support her research. And she's very dedicated, you know, to wanting to do the best, you know, find the best way for pregnant women to quit smoking. So please, her email's down there if you want to get in touch, and I'll try and get the link for you. So that's from me today. So any questions? I'm happy to take them.